we will discuss how doctors go about evaluating and diagnosing peripheral nerve problems, particularly those that affect the lower extremities or legs.
Peripheral nerves are the ones outside the brain and spinal cord, and they play a key role in movement, sensation, and muscle function. When these nerves are compressed, irritated, or injured, it can lead to symptoms like pain, weakness, or numbness in the legs. One common condition that can cause such symptoms is called lumbosacral radiculopathy, where the nerves in the lower back are affected. But there are also other nerve conditions that can target the legs.
When a person has an issue with their peripheral nerves, they might experience different symptoms depending on which nerve is involved.
They could feel pain, tingling, or a pins and needles sensation, or they may notice numbness or muscle weakness in a particular area. The location and nature of the symptoms often help point to which nerve is involved. For instance, if a nerve in the lower back is irritated, the pain might travel down the leg, something many people recognize as sciatica. In some cases, the problem might be so mild that it only shows up when specific tests are done. For example, doctors might detect slowing of the fibular nerve, also known as the peroneal nerve, at the knee, suggesting mild compression. Interestingly, older individuals often have mild radiculopathy without even knowing it, since it doesn't always cause noticeable symptoms.
To figure out what's going on with the nerves, the doctors typically start with some form of diagnostic testing.
One of the most effective ways to diagnose nerve problems is through electrodiagnostic tests, which include electromyography, EMG, and nerve conduction studies, NCS. These tests help doctors measure how well the nerves and muscles are functioning. For example, if the fibular nerve is compressed at the knee, these tests may show that nerve signals are slower or that muscles controlled by that nerve aren't working as well. EMG is particularly useful for identifying nerve root problems, such as radiculopathy, and can also provide important details about how severe the issue is.
Imaging studies are another important part of the diagnostic process. When there's a suspicion of a nerve problem, particularly when there's back pain that spreads down the legs, as seen in radiculopathy, magnetic resonance imaging (MRI) is often the first imaging test doctors will order.
MRI is excellent for showing whether something like a herniated disc in the spine is pressing on a nerve. But for issues that are more specific to peripheral nerves, such as compression injuries in the legs, ultrasound can be extremely helpful. Ultrasound allows doctors to see if a nerve is enlarged or shows signs of damage, and it can be particularly useful in spotting nerve compression. For instance, if someone has a problem with their fibular nerve, an ultrasound can show whether the nerve is swollen or compressed. In cases where an MRI isn't possible, such as when a person has a pacemaker, a CT scan can be used as an alternative. In some cases, blood tests can also help with the diagnosis. Although these aren't usually the first tests a doctor turns to, they can provide valuable information in certain situations. For example, if a person has diabetes, blood tests that check blood sugar levels might reveal nerve damage related to the condition. There are also specific blood tests for conditions like Lyme disease, which can affect the nerves, or for rare genetic conditions that make someone more prone to nerve problems.
In more unusual or complex cases, doctors might consider doing a lumbar puncture, also known as spinal tap.
This test involves taking a sample of fluid from the spine to check for signs of infection or inflammation that could be affecting the nerves. This is usually reserved for situations where the diagnosis isn't straightforward, and more information is needed to distinguish between different nerve issues. In general, the process of diagnosing a nerve problem starts with a detailed look at the symptoms and a physical exam. If there are signs pointing to a nerve issue, doctors will often use tests like EMG and nerve conduction studies to get a clearer picture of what's happening. If there's a concern that a nerve is being compressed or irritated in the lower back, an MRI may be ordered to see if there's a disc or other structure pressing on a nerve. And for more complex or unclear cases, additional imaging like ultrasound or even a lumbar puncture might be needed to gather more information. The ultimate goal of all these tests is to pinpoint the problem and figure out the best course of action, whether that's through physical therapy, medications, or surgery.
Each test provides a piece of the puzzle, helping doctors understand what's going on with the nerves and how best to help their patients feel better.